Hello and welcome to another podcast from Odell Technology. Today we have Ledidi from Oslo in Norway. I will get the people who you can see on the screen currently to introduce themselves. If you wouldn't mind starting, Andreas.
Hi, everyone. Thanks very much for inviting us onto the podcast, Stephen. I'm very excited. My name is Andreas. I'm Director of Partnerships at Ledidi. I'm not a medical, I don't have a medical background. I'm an MBA, so I hope that doesn't fully discredit me, but I've been with the company for a year and a half or so. And in my prior life, I used to be an IT consultant and also founded a tech startup.
Chris.
Brilliant. Thank you, Stephen. It's great to be here and be able to speak to your community. So I'm Dr. Chris McKee. And my background, I'm a PhD cellular molecular medicine, what my friends call a paper doctor. I do have a pretty good understanding of at least the science behind medical practice and obviously biomedicine linked with that. Following that, I actually worked for the private sector for a number of years, working with companies such as AstraZeneca and contract research organizations like Covance, which is now obviously fused and become one with LabCorp. So I did that for several years in a range of science-based positions, quality control positions, study management positions, learned about many things that you don't necessarily learn on a PhD. And I've spent the last 4 years actually working in the NHS, at the Leeds Teaching Hospital NHS Trust, as well as the University of Leeds as a visiting research fellow. So that role was more around business development and innovation within that setting.
Thank you very much, Chris. All right, I might ask both of you the one question, and can you tell me what Ledidi is and its origins and where it is today?
So Ledidi is actually the name of a fruit, often referred to as the miracle berry. And the fruit is something where if you eat it and then you eat something sour, it's going to taste sweet. So there's a bit of an analogy there. And what we are as a company, we're a Norwegian software company. We're founded in 2016, but by a team with extensive medical and research experience. We're trying to solve the persistent issues of collaborating on health data, doing for secondary uses like research, clinical auditing, those kinds of post-market surveillance. And these issues have really persisted over decades, and they've just been amplified with the increased tightening in terms of regulatory, GDPR, HIPAA compliance, FREMS 2, these different issues. So it's still very much a massive pain that we're trying to solve with our solution that enables clinical registries, health research that really is built for collaboration. It's really easy to use. We want to provide sort of the iPhone experience, if you will. So does iPhones have the best cameras? No, but they're certainly good enough for most everyday use. And it really just shapes the way that that people communicate and collaborate and create. And that's sort of what we're bringing to the health research space.
Okay. Chris, would you like to add to that?
Yes, very happy to sort of add to that. I mean, Andreas is completely right. To me, it's a solution that's come forward that truly levels the playing field for people working with data analytics and managing data. So realistically, people are working with a range of solutions. I'm sure we'll go into more detail in this in the podcast, which are not what I would call suitable really for 21st century practice. We're going forwards with digitally driven solutions, digital-based healthcare systems, digital-based lab books. That's the future of where we're going, and we're going to leave people behind if we're not careful. So Ledidi really comes forwards and provides that true end-to-end SaaS solution for doing everything Andreas just said, to level the playing field for people in a truly safe and secure manner, complying to confidential computing, and allowing you to do that with collaboration built in mind. So it's a vital piece of kit, and I can be honest that if I had this in my PhD, I would have saved months and months of time of trying to do my analytical work and all of the training I required to do that. So, yeah, I think for me, it's a really important piece of kit.
In this world of medical device regulations in the European Union and GDPR requirements, how does Ledidi help a biotech, medtech, pharma company with these new requirements?
Yeah, so when you look at MDR, and especially articles dated 283, which speaks to these post-market surveillance systems, which are really about requiring medical device manufacturers and pharma companies to systematically and continually monitor and assess the quality, performance and the safety of their devices in the real world. It requires people to collect real world data. So that means involving clinicians, for instance, to get as close to the patient as possible, bringing that data all the way back to the manufacturer so they can assess how it's performing in the real world. You can also monitor how it performs both against the target population, but also how it differs across different subpopulations, such as ages or sexes or geographies and so on. But it's really also about taking that information and relaying it to the relevant stakeholders, like notified bodies, regulatory authorities, and so on, in cases there are adverse effects and these things. So what we do is we have a registry solution which also does real-time analytical statistical analysis and data visualization. And this is incredibly powerful to help enable the PMS requirements under MDR and also under FDA for that matter. So clinical registries can be a really powerful tool if done correctly to cater to all the needs of all these stakeholders that must be informed throughout the under the MDR.
Okay, Chris, would you like to add anything?
Yeah, ever so slightly. Andreas has covered it very well. I mean, I think it's important to obviously mention that different environments, different regulations to adhere to. FDA, MDR within the EU, and obviously now UK, CA. Now that we've separated, but the point of the matter is no matter which market you're in, post-market surveillance is vital, and the ability to stay connected to the front line to understand how your product is performing, and by product I obviously can mean anything from a therapy to a medical device solution. You need to understand how it's functioning, how it's performing, whether it matches the data that you had prior to going onto the market, and also it's an iterative process. Do you need to tweak it, adapt it? Do you need to provide support to services? So to me, the ability to have, for example, effective registries linked to the provider is really important, and that is quite a tough problem to solve if you don't have the right tools. And this is where Ledidi comes in, I think, very, very handy as a result. So it does allow that connection to be maintained, whilst people also retaining the autonomy and control and security, really, of their data. Healthcare providers in particular are not keen to share patient data if they don't need to, and they would like to have a bit of control over that. So I think as a whole, you do need to have the right solutions to enable effective post-market surveillance, and I strongly believe that's what we're here to do.
Okay, so I guess the obvious question coming out of those statements is, how do you enable someone to capture real world data or gain insights into real world data?
Certainly, I can maybe start this one. So the truth of the matter is it's about being connected to the relevant institutions. So real world data, it can come from in many shapes and sizes and many different forms. It can come from many different institutions. But when we're talking about healthcare, really it's coming from the front lines. It's coming from the patients themselves. Patient reported outcome measures are actually very, very important. It's coming from the clinicians. It's coming from who I also obviously include nurses and everyone on the front line when I say clinicians there. It's really, really important to be connected to them. Now we are entering a world, a very positive move towards having effective electronic healthcare record systems and EPRs, and we're having and some systems are better than others, and a lot of this information that we're referring to actually gets stored in there. Some people are still using paper forms, but ultimately a lot of this is uploaded into those systems. A lot of registries are being captured. They have been captured for a while, typically in Excel, for example. It's not uncommon. Even if we disagree with that, that's what a lot of people do. But the truth of the matter is there's a big gap there between the provider of healthcare and the people who want to access that data. So you need to have a system which can talk to it, or at least that is easy and simple to use. So Ledidi does offer the ability to link with those with those systems, or to import data from CSVs, for example, into Ledidi Core, which is the name of the platform we're using here. It really does help to bridge that gap. And it is quite a big gap. I'm sure quite a few of your cohort and members here are listening to this, and they've probably got all their stories to tell about accessing data is tough. It's difficult, particularly when you're talking on an international scale. There's a lot of data in the UK and the NHS that people really want to get hold of, and it's tough. But maybe the reason for that is because the solutions haven't been provided to do that in a way that people feel safe and secure, and that the patient is safe. And this goes for if you're working in the States, it goes for most other countries as well. People are naturally protective of this data, and they should be. So giving people access to it through a system like ours can, as I've said a few times now, it can be a really effective bridge to help with this whole pathway and process.
Okay,
that's my opinion.
Would you like to make a comment?
I think it's, to summarize, our solution is incredibly easy to use. We streamline the process of getting started, of inviting collaborators, making it safe and secure to collaborate, whether you're a frontline staff, you belong to the manufacturer's organization, or whether you're someone who just wants the outcomes of like looking at the stats and then the insights. And there are streamlined data capture and data entry processes that we enable, and it's immediately available in real-time interactive dashboards. So that's how our solution works. And it's built with collaboration in mind, enabling collaboration across national borders. So really enforcing that privacy-preserving multi-party computation element of this, being able to analyze without being exposed to any primary data. It's incredibly powerful, and kind of have to see it to believe it. And then I think also you spoke to, Chris, that we do also offer API integration. So let's say there are data coming from the device itself that you want to capture into this registry. We can enable that as well and combine it with the clinical data, with the prompts from the patients, and getting a really good and holistic view of how the device is really performing in the real world.
So that's how you create actionable insights through that process? Okay.
Yeah.
Okay. No.
I mean, just to kind of make a point on that, Stephen, it's actionable insights come from the fact that you have real world evidence backing it up. Unless you can see what's happening with your patient group and patient population, it's very, very difficult to act upon it in a truly effective population-wide manner. Granted, you can be relatively effective with an individual patient because you're there, you're in front of them, and you can, and as a clinician, you can manage them. But when you're talking about an entire group that come under a particular disease type and category, it gets much, much harder. And we're moving towards the realms of personalized medicine as well. It's only going to get tougher. So yes, essentially having the relevant insights that are easy to access and visualize is vital.
Absolutely. So I suppose that the big question for me is, can you discuss any real world cases that you're involved in, or any current clients that you've got with confidence?
So, for instance, if we're discussing post-market surveillance, I actually saw an email this morning with one of your other podcasts guests looking to do this. So we're going to do much more in this space. But another one of your friends, a certain robotics company, is using this, where they are combining data from the robot with input from the frontline staff and using that. So we have a lot of very interesting cases coming up. We're still a young company, so we have a ways to go, but I really think we can make a dent in this market.
Yeah, certainly.
Anybody in the pharma space you're able to discuss?
We're working with Pfizer and the NHS. It's slightly different. It's not for pharma purposes. This is for clinical auditing of breast cancer practice, but it's a very good collaboration that we have with Pfizer, and we'll probably do more similar stuff there.
I think that's extremely interesting. And I think working as a conduit between pharma and the NHS is extremely useful. Can you tell me something about the pricing structure and how dealing with you works. How do people engage with you?
Yeah, so pricing is, we're a SaaS product, software as a service, which means we're sold to users on a monthly subscription basis. The cost right now is 70 euros a month. And with that, there's no limitation to the number of projects that you can create or be a part of. So for me, it's kind of like a Netflix subscription where you can really binge watch and get a lot of value from that subscription compared to having to go to Blockbuster. Every time you watch a movie, it costs $1, right? So in that sense, costs scale with your activity and the output. And whereas on our platform, that isn't the case. You get more value the more you use it. So that's really something we encourage. In terms of engaging us, you'll find a friendly Norwegian bunch. And really the platform is incredibly intuitive, versatile, and easy to use. We cater for a lot of different use cases around secondary uses of health data, whether that's clinical research, post-market surveillance, clinical auditing, and other things too. So with minimal training, you should be able to do things yourself. You don't require us to bring a huge IT department or a systems integrator to get started with and getting value from our products. I can share some stories. A national registry that was being built in the NHS. There's a video on this online, which is very interesting. They spent about 4 years with trying to build this national registry on another platform, and they just couldn't do it. Then they moved to our platform, and they did everything themselves in about 4 days. Another story, we have 7 of the national Norwegian COVID-19 studies. The first one was built in about 4 hours and deployed to 16 hospitals nationally the next morning. So you can really see the ease of use is transformative, especially for smaller and medium-sized enterprises, which may have limited capacity and resources. So the time to value on our platform is just radically different than anything else on the market.
Certainly. I mean, if I could very quickly add to that as well, from my experience of this and seeing a range of solutions over the years and different costs and prices, and how public sector organizations tend to look very closely at this because they don't necessarily have a big budget behind them. The pricing model that we have currently and in the future is supposed to be accessible to the everyday user. We're talking here about even students and PhDs here who need to have access to these solutions. So it's built, and with that in mind, it's in terms of costing. It's not supposed to be only for the big organizations to be able to afford this. It is about the individual user being able to say, well, I need this for 3 to 6 months or so. I can afford this. People will pay for Microsoft Office packages on an individual basis, and realistically, we're cheaper than that. So that, I think that comes with a lot of advantages, certainly.
I think that's a very good comment, actually, and I think that, Chris, with your background in the National Health Service and your academic background, I think they're very pertinent comments. I would like to see the National Health Service personally adopt a lot of the registry, because I happen to think the registry is one of the best I've ever seen. I've seen a number of registries used internally in the National Health Service, and I've seen it used in France, and I happen to think this is the best I've ever seen. Hence, we're having this airtime today. Is there anything else that you'd like to add to this conversation about the system and about the future of the system?
Certainly. I mean, for me, it's the advantage of the system here is it aligns to my own personal thoughts on something I call sort of the holy triangle of effective collaboration and innovation. So what I mean by that is, you've typically got in a relationship when you're working between either pharma, clinicians and academics, you've got that triangle going on. You've got each of them as part of a pathway of getting where you need to go, whether that's on testing a therapy earlier on in the pipeline, whether it's getting academic support to define a need within your company, particularly as SMEs do require that support, or whether you do need that post-market surveillance and the ability to link and have effective registries that you can have access to. So what I refer to there, the holy triangle, is essentially everyone's part of the same pathway. Everybody is really saying the same thing, but in slightly different ways. And they need effective ways of working together and to be able to share insights with each other so that they can each deliver their own individual KPIs. And you need to be equipped with the right tools to do that. Ledidi comes in and it really, really does help with that. It does provide people with the information they need. The clinicians get what they need out of it. The researchers are able to publish effectively from it because they can get the data from it. They have a full audit history of where the data's come from. They're enabled to be able to perform statistical analysis much, much quicker. The pharma companies, the CROs, anyone who's sort of managing this from the commercial sector, they can get real-time updates from their partners and not just highlight reports, which might actually be missing information. I think it's really, really important to bear all of this in mind, in addition to the fact that it is built there with ease of use. I agree with you, Stephen. I know I work for the company. I'm a bit biased now, but even before then, I was working with Ledidi, and the registry just stood out to me, and many clinicians I introduced it to. They have years and years of data that they just don't have effective access to. And this is just immediately put thoughts in their mind of, right, well, we can finally do something about this. And it's evidenced.
I agree completely. The question I have is, if I'm a patient, can I be, and I'm using one of these things, can I be included in the registry?
Yeah, we do have survey functionality as well. So yes, that's possible.
Yeah, it's a very interesting point, Stephen. They are being able to send the forms directly out to the patient is certainly part of the PERF pathway. I'm really, really interested in patient-public involvement and engagement. It was a huge part of my last job. It's something that I'm routinely putting on the table with all of the clinical teams I'm talking to at the moment who we're planning to partner with. The question is do the patients actually want to see their data in this manner? It's actually an interesting question. They might genuinely not want to see it, or they might do. I know for myself as a patient, I would love to see it. I don't like someone saying, here is your answer. And I'm like, well, how did you get to that conclusion? So I think some people will certainly will. So it's in the pipeline, and I'm sure we will have some really interesting publications in terms of PPIE in the near future that can align to that question.
I think patient-reported outcomes are extraordinarily important, and if done well in a framework like yourselves, a framework that you've created, then I think that we've got a very rosy future. Okay, Joe, I've really enjoyed this, and tell me, if somebody wants to make contact with you, how is the best way to do this?
So you can go to our homepage, ledidi.com. There's a button at the very top saying request a demo. Click that, fill out the details, and either me or Chris will be in touch. Otherwise, you can just reach out to us with emails. I'm sure you'll display in just a minute. And really a call to action, guys. You have to see Ledidi Core to believe it. It's amazing.
Yeah. And we have, in my opinion, we have a pretty open front door. If people see value in what we do and they want to work with us, we will work with you. We go where the energy is, and we're growing, we're expanding as a company, hence the international expansions. And we're here, we're ready to do this. We're ready to show you and prove to you what the solution is capable of and how it can really help you in your everyday working practices, whether you're a huge multi-center CRO and pharma company, a startup and SME, or an academic institution or public sector service. So we're here, and we're very keen to engage with you all.
That's perfect. That's really good. Okay. Wish you all the very best.
Thanks
Thank you,
a lot,
Stephen.
Stephen. Great to see you.
See you guys.
Take care.
Bye-bye.